Today I'm going to be doing a video talking about nursing versus respiratory therapists, to tell you the differences and similarities of what we do and tell you like what we do. So this is my friend Shavonne.
Hi y'all.
And she graduated
December
2019, a semester before me, and she's a RN.
Yes.
So I decided to do this video with her. Just so you can like hear a nurse's point of view about nursing and whatever. So
like, subscribe, and comment below.
First, before we start off, me and Shavonne met in microbiology. We met in chemistry.
Okay.
10:30, and we also took microbiology together. So that just shows you that respiratory therapists and nursing take just about most of the same prerequisites. So anyways, we're gonna get into this video. I wrote down a couple things that I wanted to talk about, and the first one was, where do you work and what unit? So I'm gonna have Shavonne go first.
Alrighty, so I work at a HCA in Orlando, and the unit I work on is the CVICU.
And I work at a bigger hospital. I ain't gonna tell y'all where I work, because I know y'all
some creepy.
Creepy, but I work at a bigger hospital. It's not an HCA hospital, but it's a non-profit, and I work on different floors. I work on the rehab floor. I work on like step down units. I work everywhere but ICU. So yeah.
So for those of you who don't know, like when she said like it's a bigger hospital, so there's like more so like public hospitals, and then there's like kind of like private hospitals, and those are normally like smaller, like HCA, and then like you'll have bigger hospitals like Advent Health, Orlando Health, or things like that.
Right. So. And HCA hospitals are really good. I actually did clinicals at one Capital Regional in Tallahassee, and they're really small, and like they're like, I don't know, you worked, it's a lot of teamwork involved in those hospitals, and I like them.
Yeah. Also, I did the Star RN program, so like they have a great first year program for new nurses, and I recommend you guys to go through that program because they teach you EKGs, they go back over like all of your nursing skills, so it's very a good program to be a part of, and for new nurses to like build their confidence and stuff in the real world.
That's the one you posted on Instagram that time.
Which one?
I remember you're like, nursing students should do that.
Oh yeah, the EKG. Yes.
So what is that?
The EKG?
No, like, what is it, a class or?
Oh, so the Star RN program is like a year of commitment, and basically, actually it's like 2-year commitment, and basically they go over everything that you learned in nursing school, and they go over EKGs, they do more like simulations, like it's not just one of those like, let's pretend the dummy is coughing or something like that, like it's real simulation. So like you're gonna hear them coughing, you're gonna like see the vital signs go up or go down, like it's very like hands-on and interactive. And let's see what else. That's the Star RN program. It's so much. I think it's like, okay, so you have didactics and then you have preceptorship. So didactics is like 4 weeks, and that's when you do the simulations, you do like all of the skills. They check you off back on IVs, central line dressing changes, every skill you could think of that you learned in nursing school from first year to your last semester. And then the preceptorship is when you actually go to the hospital and you actually have a preceptor, and you do the same thing as like before you graduate nursing school and get even more hands-on and more confidence, so you can actually be on your own and be successful.
sounds pretty cool. I wish we had something like that.
But stay tuned. I'll have like a different video.
Shavonne has a channel, so I'm gonna put her channel down below.
Yeah.
Okay, well, next thing is how was school focuses, like what were your focuses and what was the hardest part and the best part?
Okay, so how was nursing school? Nursing school is like up and down. You'll have your days. I definitely feel that FAMU nursing school has prepared me for the real world. I wouldn't take back anything. Of course, you have those long nights of studying and stuff, but if you really stay dedicated and motivated and you get it done, you can end up where I am and, be on the unit that you like. So definitely take it serious. The best part of nursing school? The best part of nursing school, honestly, okay, so being in the real world and like seeing how that, I would say actually being around like-minded people in the same age range to like get through it with you, because like when you get in the real world, you have so many different ages and majority of the time they're older than you, so like you kind of on your own. Like they're not gonna understand you because like they may have already had kids and like they just have their own stuff going on in life. And so I would say that's probably one of the best parts of nursing school that you should value and cherish.
Right. And that was kind of the best part of being in respiratory school also, like everybody, well, at our school, people were like around the same age, like the same mindset. We all wanted to finish respiratory school. It was a hard program, like it was extremely hard. Like we would study all day, every day. Like sometimes I really wanted to give up. And like if you are thinking about respiratory and nursing, just know that they're both difficult programs because nursing, they focus on, I feel like, overall everything. In respiratory, we focus on like, we get deep into like the heart and we get deep into the lungs in respiratory, of course, because we're respiratory therapists. So they're both difficult programs, but it's really awesome when you finish it and we're all on the same focus. So I feel like that was the best part, and the hardest part was just all the studying and all the tests and the exit exams.
Yes.
All of that. So
definitely. Also, the biggest tip I would say like during school is like focus on what's on hand. Like focus on what matters at that time. Like if you're just starting the program, don't be thinking about the exit exam because like that's not gonna really help you get through the program. You need to focus on like what they're showing you and trying to teach you at that time. And then by the time you get to the end and it's time to take the exit, you can pull everything together and you'll be more familiar than like not worrying about the stuff at that time and then getting to the exit and you're like, oh wait, I can't even remember if we learned this, if she went over it, he or she went over it. So definitely like focus on what's in front of you at that time. Like break it down by semesters, because if you try to like clump everything in at one time and it's like just not the time for that, you're going to be confused, you're going to be lost. So
right, and that's the same for respiratory school. That's why they break it up in different semesters, because you need to learn like each different things. Like at first we have anatomy, and then we have anatomy and pharmacology, so we could get, that's the same for you, right? Having like prereqs. At the beginning of our programs, and then at the end, like towards the last semester, everything is like brought together. So don't worry about it when you first get it, because it will come all together.
Exactly.
It will really come all together. So next one is a typical day / the hardest part of the job.
Okay, so we're both on night shift, so that is, very interesting, considering that I didn't think I would be a night shift nurse. Like, I really be asleep by 9. So the fact that I even received the night shift position, I was like, oh my God, I don't know, like if I'm gonna stay up, I'm scared I'm gonna fall asleep. But honestly, like when you start off, you're gonna be so excited and so willing to learn that you're not even gonna like realize what time it is. Like it's gonna really fly past and stuff like that. So a typical day, come in, sign in. Well, we have like a Chronos is what ours is called.
Yeah, we have Chronos.
Yeah, so like you just swipe your card, your badge, and then go on your unit, and then look at your assignment. And then like kind of just prioritize like which patient is like more important at the time based on their conditions, and then kind of go from there. Like honestly, it's still new to me. Like it's so different every day. I'm telling you, like the hardest part I would have to say is like just trying to get everything organized. Like, and one big tip I would say is like starting off, you may not have like access to the Pixes on time, or like Meditech, or like whatever documentation software you use may not like let you sign in. So like kind of just be patient with those things, and just kind of like work with it, because I know that has like held up a lot of my time. Like if I couldn't get into the Pixes to pass medications, that would like delay my routine. So then like my preceptor would like come and help me and stuff like that. So everything is pretty like settled now. So I would say hardest part probably would just be not knowing was today a hard day, like how busy it's gonna be. I think that's probably the hardest. Yeah, because even if you got it down pat one day, the next day is different. So it's still new.
No, I definitely agree with that. When you first go in as a respiratory therapist, you're like looking at the assignment, and sometimes I'd be like, let me have an easy assignment. I'm tired today, let me have an easy assignment. And then I look at it, I'm like,
oh my God.
Like, I got like 4 or 5 trach patients, I gotta clean all them throats, and I gotta get all these breathing treatments, and I just be like, this is just freaking crazy. But for example, one time I had this guy, his CO2 levels, if you don't know, like that's the carbon dioxide building up in your body. His CO2 levels were out of control, but I had like so many breathing treatments, so many like lung therapies and lung exercises, but I had to deal with him first, and his daughter was a nurse, so like of course like I really just gotta focus on him. Like his daughter's a nurse, she knows everything. So I went to him and I stayed with him for like 2 hours. I gave him an ABG, and I did an ABG and everything on him, and I still had everything to do. But what I did was I asked for help from the other therapist or whatever. But like, yeah, that's the hardest part, never knowing what your assignment is. Every day can be different. Like when I first started, I had patients dying, and it was just crazy. I had to speak to them. I was like, I'm new, this is a bit much. I'm not trying to kill nobody, so can you like lessen the load for me? But every day for respiratory therapists, we do the breathing on the floors. We do like the breathing treatments, we do like the vest exercises, we do like incentive spirometers, of course that's nothing. We take ABGs, we do EKGs at some hospitals, we do cough assist devices. In the ICU we do like the nitric oxide, they do a lot of ECMOs and stuff. We work with just a lot of different
ventilators.
Issues. Yeah, ventilators, main thing, non-invasive ventilators, stuff like that. But, yep. So the diagnostic tests you do.
You basically said drugs. Okay, so mine would be, we really do a lot, everything, labs. It is so much. Like we do EKGs. A lot of times we do have help from like radiology. What else? Let's see. Radiology comes. We have respiratory therapy that come. Like we get a lot of help, but we are familiar. Like nurses are familiar with like what the procedures are. Luckily, like we get to send them down to like the different departments or like units or whatever to like get those like diagnostic tests done. But at the bedside, we can do EKGs. Matter of fact, CVICU to be specific, because we really work with the heart. EKGs and labs. We can do bladder scans. So that's like if you can see like if there's fluid retention, we can look in the use the ultrasound and look and see like how much fluid is in your bladder, and so much. I can't really think of all of them, but
I know nurses do a lot of different
I honestly can't tell you. And then like, you know, different hospitals require nurses to do maybe more diagnostic, less diagnostic. So it just like depends on like the area you're in and like how much help you may get.
And for respiratory, we do like ABGs, we do nocturnal to see how well they're setting at night. We don't do as much as nurses for the diagnostic test, but we do some things, and we gotta like analyze it and interpret it and page the doctor or whatever and tell them what's going on. So
yeah, Sam, we have to interpret it too. And then also like with the diagnostics, we normally, like as nurses, our role is to like anticipate what diagnostic test they'll need, so then we can call the proper like resource to like get that test done for them. So yeah.
And the last one is future goals. Like, where do you want to be, like, for example, in 5 years? Where do you want to be at?
5 years, I definitely will be back in school, getting my DNP.
Okay.
And yes, stay tuned. I'm not gonna tell you everything, but you know, just know I'll be in school by then and pursuing further education, particularly NP or CRNA. But just stay tuned.
And CRNA, the anesthesiologist, right?
Yeah, it stands for it's basically a nurse anesthetist. So
Alright, and me, I wanted to be a physician's assistant. I wanted to be a midwife. I wanted to be everything. But honestly, I do not know anymore. There was a respiratory therapist that I met at my job. She graduated from the same program I did at FAMU, and she was talking about going to law school. Now I'm like, am I going to law school to practice like medicine and stuff, and like people trying to sue like healthcare workers or anything? So I really don't know, but I know I'm not staying respiratory my whole life. But that's a good thing about bachelor's in nursing or in respiratory. Like, you can just advance your degree, and that's the benefit of getting your bachelor's, because a lot of associates, they're gonna have to do that later on. And
yeah. And then I just found out about flight nursing, and that seems pretty cool. So like that's something I'm looking into, but you know.
What's that? Just like in the air?
Yeah, like basically transporting patients like in the air and stuff.
They have
like,
that in respiratory too.
Yes, like that is so cool. So that's interesting, something that I wouldn't mind doing.
So yeah, this is the conclusion of our video. I hope you all made it to the end, and I hope you all see that the differences and similarities between respiratory and nursing. And I want to give a shout out. We both want to give a shout out to FAMU, because without y'all we couldn't have our degree, and we loved our program, and like you really did prepare us for the real world, and we are just like the best healthcare workers out here. We're saving lives, and yeah, we Black women in medicine. So subscribe to my channel, and like I said, I'm gonna put Shavonne's channel down below. Yeah, so that's it. Bye.